Okay, if I could make a start, we'd like to present a resume of a project that we've entitled Supporting Educators and Practitioners in Developing and Delivering IPE. The three of us on behalf of CAPE have been involved with this work, and we all have close associations with CAPE. And I know we've all introduced ourselves, but just very briefly. First is Jenny Ford, who comes from a speech and language therapy background. And she's also got a long and extensive academic background at De Montfort University in Leicester. And second, we've got Emma Smith, and Emma also comes from a speech and language therapy background. And she's had much experience with IPE, but also has had extensive experience as a service user. And really her input into this project has very much been from this perspective. And then I have a medical background, and I'm also an honorary CAPE fellow. So Jenny, if you could move on to the next slide. Now, the purpose of the project was to evaluate a new IPE handbook that was written by Jenny and me. And the process was to develop and implement 3 pilot workshops, which we hosted at NHS trusts in England. And these workshops were structured around the contents of the handbook. Now, we specifically designed the handbook as a succinct how to do it guide, and it was really for health and social care practitioners who had very little time to access or read detailed background material. And the book really focused on helping practitioners to focus on developing and implementing an IPE event accompanied with relevant theory. The purpose of the project was really to evaluate the impact of this intervention, and with these aims in mind, and that was to facilitate educators and healthcare practitioners to develop knowledge and skills of IPE in practice. And secondly, to facilitate the development of IPE champions locally. Now, this project came about through a series of discussions between CAPE and Health Education England. Now, Health Education England is a public body which is part of our Department of Health. And its function really is to provide national leadership and coordination of education and training of the health and public health workforce. And as Health Education England say, their aim is to ensure that the workforce of today and tomorrow has the right numbers, the right skills, values and behaviours at the right time and in the right place. So CAPE was commissioned by Health Education England to develop this pilot project, really with a possibility of rolling it out nationally throughout England. And I'd now like to hand over to Emma.
Hi, yeah. The service user involvement, myself and another service user on the board of CAPE were involved in reviewing the draft handbook from a service user's perspective, and there was things that we potentially made changes to, which we did. Because it's really good because we're an equal member of the facilitator team, which wrote and revised the workshops. And at the workshops, we actually co-facilitate, and it's really like, oh gosh, for some of the participants, they really value our input, and they're actually quite surprised that service users involved in inputting in training us. What? And then when we did the workshops, we had 2 neutral service users who acted as observers, and they wrote reports for the evaluation of the documents of the draft. And it was the intention that the trusts and universities would invite service users to attend the workshops as participants, as it's intended, but unfortunately none were present. And then as the workshop set up, well, it's a project team of 3 people who we work working professionally together and throughout. And there was me, Jenny and Richard Gray, and the workshops are planned to meet the local needs of the where the universities were and the HIEs to help to prepare them. And we had preliminary meeting with the trust and HIEs, and they invited the participants.
The handbook and the workshops upon which they were based were really divided into 2 parts. The first part of the handbook and the morning of the workshop, it included an explanation and a background of IPE. And this was found actually to be particularly important in the workshops, as many of the participants assumed that they already had a full knowledge of IPE, and actually they were found to have differing basic understanding. Now, the second part of the handbook and the afternoon session of the workshop was really more of a practical guide to the planning and the implementation of an IPE event, starting really from the planning and working all the way through to the evaluation. During this session, each of the participants had an opportunity to plan the application of their learning to their own individual practice. This is an example that is taken from part of a page of the handbook, and it's a flow chart that summarizes the required development planning and evaluation of an IPE event. And it goes right from the initial idea, the planning, all the way through to the evaluation at the end. And from the evaluation of the workshop, this particular part was reported as being one of the most useful sections, both in the handbook and in the workshops.
Okay. Emma.
Yeah. Workshop participants, well, as Richard says, there were some who thought they had previous IP knowledge, and experiences, but they didn't really. I mean, and so it ranged from the high levels of IP professionals, and it kind of dropped down to even some professionals who don't really know they were doing IP or utilize it, and even some professionals, almost the cleaner. But the numbers like across the workshop, so it was 35, and there was a big range of professions, which is great for IP. So nurses, midwives, OTs, doctors, librarians, so I said nearly the cleaner, managers and technical demonstrators, university lecturers and practice educators. And the workplaces they were from, well, as it says, practice in the HIEs and universities. And as I've already said, it ranged from seniority for managers, but dropped right down to students.
Okay, so I'm going to talk a little bit about the evaluation that we did, which was a big part of the remit of this piece of work. We collected, in the end, qualitative data. We had pre and post workshop forms from participants who self-assessed against the learning outcomes, but also told us about their expectations of the workshop. They gave us immediate feedback after the workshop using a relatively standard form. And as Emma's mentioned, we had a service user observer who wasn't part of the project team at each workshop, who took notes under a sort of structured record form. The facilitators all wrote reflections of the process, and we kept examples from the workshops of notes, flip chart notes, and also of the planning activities that Richard mentioned, which the participants undertook in the afternoon. We analysed the free text data thematically. The feedback after the workshops, people gave some really interesting comments, and we found it most helpful to take each form as a whole and analyse the text rather than looking at separate questions. We took an action research approach, so we looked at feedback between the workshops and made changes, mostly between the first and the second workshop. And obviously, as Richard's already said, the aim was to make recommendations for larger scale delivery. So this is just a bit of a flavour of our data. So this is only the post-workshop data from the evaluation forms. We came up with four themes about the experience of the workshop, and also a theme which was quality of the workshop. So under what I learned, we were struck by how many participants were slightly surprised to find that they thought they understood IPE, but realised that they didn't have a very full understanding. We were also really impressed that people talked about being interested in the theory, deepening their knowledge of the theory and finding that useful. Participants talked about how they learned. They really, as Richard's also said, valued the practical activities, particularly the planning activity, but they also hugely valued learning interprofessionally with others and commented on learning about others. They also talked about very specific plans for applying what they learned. And some talked about approaching IPE differently in future. And one person particularly said challenging something that's presented as IPE that they now realise isn't really IPE. Under quality of the workshop, there were no sort of overall negative comments at all. There were lots of positive comments, and there were actually lots of suggestions, some of which were things like you could change the word order on that slide. So anyone who wants to know a bit more about the feedback, we can tell you later. We've included a few quotes just to give a flavour of the data. So I think I'm just going to start.
Yeah, when someone has reported that one of the best aspects of the day was there's lots of group activity and applied learning from the morning into a useful exercise in the afternoon. That was from Milton Keynes.
The IPE planning flowchart, which you briefly saw, extremely useful both to me and the wider team.
And one of the quotes from Oxford was that the service user input was very useful and refreshing.
Someone at Aylesbury said, I'm going to make a personal goal to develop a team, to develop an ethos for further IPE within the school and university.
And then also it was an excellent chance to meet other professionals from different backgrounds and exchange ideas about teaching and learning.
And there were various comments along the lines of great handbook. So this is just a bit of a flavour of our conclusions and recommendations. We were obviously making recommendations in a particular context of this work in England for NHS trusts and our universities. So a lot of the recommendations were quite specifically about that. But we did feel that our experience and our data showed there's still quite a need for education about IPE, particularly among practitioners. The handbook was very positively received, and we felt strongly, based on the data and our own reflections and the observer comments, that it would be best introduced through workshops. Within the workshop, our data shows that it's very important to ensure the participants have time to explore interprofessionally, and also to practice applying the ideas and the tools from the teaching side of the workshop. And within that planning activity, it was important to give participants an opportunity to identify their own needs and to start planning. And many of them did. And many of them also commented in their feedback that they wanted to take forward the idea they used within that workshop planning activity. Obviously, we found that it was very important to align the workshop to local priorities, and Emma's mentioned the planning meetings we had with each area, and also to demonstrate the support of senior management, and participants commented on this, as well as it being our experience in the process of designing and delivering the workshops. So that's our presentation. Thank you very much, and there's our contact details for anyone who wants to contact us. Just going to try and move the pictures of everyone so that I can